If you've just had rotator cuff surgery, this video covers important information and exercises that you can do within the first 6 weeks. Hello and welcome to the Physio channel. My name's Daniel Lawrence. In this video, I'm going to show you which exercises are typically safe within the first 6 weeks after a rotator cuff repair surgery. We'll look at why early movement matters and how to protect your surgical site whilst reducing pain and stiffness. Please note this is a general educational video and should not replace the advice of your surgeon or medical team. So let me show you the first exercise routine and then we'll talk about why it's so important. To do the exercise, carefully remove the sling and then perform some simple fist pump gripping exercises. This could be performed with a ball or one of these grip strengthener devices, and if you don't have one of these, I'll put a link in the description. Choose one of these exercises and perform 10 to 15 repetitions 3 times per day. Finish with this simple exercise to maintain the coordination in your hand, touching your fingers to your thumb for 1 minute. These hand exercises are important to stop your grip becoming weak. Gripping also activates the muscles right up through your arm into your shoulder, including the rotator cuff. So it's a great way to get strengthening right at the start of your rehabilitation. Now, before I show you exercise number 2, here are some rules that you should follow for the first 6 weeks. Keep your sling on as advised and make sure you don't take it off too early. It's usually okay to use the hand on the operated side for light tasks like texting on the phone or maybe writing, but not for lifting any heavy objects. Don't try and do any active overhead movements unless that's been cleared by your surgeon. The movements you do in the first 6 weeks should be pain-free or slightly uncomfortable at the most. Any severe pain or worsening pain should be reported to your medical team straight away. Also, after surgery, make sure you watch and report any signs of infection. Exercise number 2 are these simple arm pumps to help maintain elbow mobility and to prevent fluid buildup in the arm and hand. You can also combine this with exercise number 1 by opening and closing the hand as you flex and extend the elbow. This is a very simple exercise. Perform 10 to 15 repetitions 3 times per day. An extra piece of advice for you: if you find it more comfortable to perform these exercises lying down, then pop a pillow underneath your upper arm on the surgical side, and this will be much more comfortable as it stops your arm dropping back into extension. This would be a more comfortable resting position, sleeping position, and exercise position as well. So next we have an exercise which helps prevent shoulder stiffness. I'll share some interesting information about shoulder stiffness in a moment, but first here is the exercise. So remove the arm from the sling and place it on the table next to you. Have something to help your forearm slide along the table. Slide your arm forwards as far as is comfortable. Pause for a few seconds and bring it back again. Perform this exercise slowly and under control, pausing in the stretch position, moving in a pain-free range, 10 to 15 times, 3 times per day. Stop this exercise if you feel any pain. A couple of exercise tips for you. Don't bring your arm across the body. Instead, turn yourself a few degrees away from the table to provide a better gentle stretch as you bring your arm forwards. Now, it's common after surgery to guard the shoulder and perhaps have it shrugged up like this, and also to potentially hold your breath as you're trying to do these exercises. So relax your breathing and make sure that you drop this shoulder and relax those muscles before you then start to perform this exercise. Here's an alternative exercise position using both hands, sliding forward over a table, pausing for a few seconds before returning back to the starting position. To begin with, make sure your upper arm doesn't go above 90 degrees. This usually allows your hand to reach the top of the head, but no further. Now, not everybody suffers from shoulder stiffness after rotator cuff surgery, but if you do, the good news is that it shouldn't affect your long-term recovery as long as you follow your rehabilitation plan. Gentle muscle activation of the rotator cuff can usually be started about 2 weeks into your rehabilitation. Gently remove the sling. Oh, and by the way, just a tip for you. When you remove the sling, if you want to use your hands, say in the shower for washing, then it's a good idea because it keeps the shoulder a bit more mobile and it also allows you to use the hand and work on the coordination. But if you just support the elbow there, then you can use the hand for washing and possibly a bit of hair brushing as well. That can be done fairly early on in your rehabilitation plan. Now, where were we? The exercises. So with the arm by the side and out of the sling, you're going to perform some gentle static, or what we call isometric exercises. Bring the hand away from the body to a comfortable position and then gently push forwards into your opposite hand with about 25% effort. That's 25% of what you imagine would be 100% of your strength effort. So push into your hand for 6 seconds with a 25% push. If that feels painful or uncomfortable, then stop and don't do that exercise. But of course you can grade it by pushing lighter or pushing with more pressure. But just stick to the 25% for now. So you're pushing forward for 6 seconds. And then you're going to do the opposite movement, which is to push back. So just put your hand behind your elbow and push back into your hand. Okay, for 6 seconds. And then you're going to push out. So you're going to imagine you're doing this outward rotation. You're going to block that with the other hand. Push out for 6 seconds. You've probably guessed what's coming next. That's you're going to be pushing in. So block again with the other hand and push in for 6 seconds. 2 more. Now this is bringing the arm away from the body, but of course we're not going to do that because we're going to block that movement and push out for 6 seconds. And then the other one is to bring your arm in, and you can use your hand, or if you've got a pillow to hand, then put that under your elbow and push into the pillow for 6 seconds. As long as those exercises are pain-free, I'd recommend going around and doing those 3 times, so 3 times 6 seconds, and just once a day is plenty. Within the first 6 weeks, you may be able to start doing some early resisted exercise within your surgeon's safe zone. Now the safe zone is usually a range of motion that the surgeon's happy for you to perform at that given time or in that given time frame. And it usually relates to the amount of rotation and the amount of movement away from the body, this abduction movement. So usually here the rotation is quite limited, but that doesn't mean that you can't start doing some resisted exercise. So make sure you ask your surgeon or physical therapist what you can start doing. Even a small range of motion is a great way to start strengthening and rehabilitating the muscles in your shoulder. When you're doing it, make sure you do it slow and under control, with no sudden movements and a suitable resistance. If you don't yet have any resistance bands, I would recommend them for your shoulder rehabilitation. I don't sell any, but I'll put a link in the description by this video. Now, even if you're getting on really well with your rehabilitation, it's important to keep protecting the surgical site because tendon to bone healing is slow and it's still fragile at 6 weeks. So make sure you continue to use your sling as prescribed and advised. But also remember that you can be too protective and guarding of your shoulder, which can make the pain and stiffness worse and delay your recovery. So did you know that strengthening the non-surgical side can help you maintain strength on the surgical side, even though you're training the muscles on the opposite side of the body? And this is known as the cross-education effect, and it's well documented in the research, so it is worth doing. Now, to make it work, it's recommended that you perform exercises at over 60% of your maximum strength. So this would put you in the repetition range somewhere between 5 and 15 repetitions, and to perform 3 sets up to a point of failure. Remember, you're just doing this for the non-operated side, but weirdly enough, it benefits the operated side as well. Here are 3 exercises that you could do: the shoulder press, the lateral raise, and the row and rotate exercise. It's important to recognize that your recovery can be slow, and that can be frustrating if you've got dependents, responsibilities, or just things that you want to get back to. Don't rush your rehabilitation after surgery, as this can cause further delays. But equally, don't be too overprotective of your shoulder and not do the exercises that you've been advised to do, because this can also lead to some delays. As we get towards the end of this video, just remember to protect the surgical site while still engaging in those early movements, and to perform those exercises in a pain-free range. And keep the communication going with your surgeon and medical team. I hope this video has been helpful. If it has, please consider sharing it with anybody else you know who may be having shoulder surgery. Showing on the screen here are some of our other popular shoulder recovery videos.